Communicating bad news is one of the most difficult tasks that doctors have to face. We can define bad news as one that drastically and negatively alters the patient's own perspective or their relative in relation to their future. The reaction of a certain patient to bad news will basically depend on their personality, religious belief, family support, and the anthropological culture in which they live. An important aspect to keep in mind when reporting is the age of the patient. Older people with less ability to assimilate complex information very often tend to misinterpret the message provided by the doctor. We have to use a simple language appropriate to the intellectual and cultural level of the patient. Before setting the adverse diagnosis, it is advisable to use an introductory phrase of a type, "I'm afraid that your evolution is not what we expect." This will give the patient time to prepare for the blow and will alleviate the emotional impact of the bad news. Constituted mainly by the fears experienced by health professionals before the possible repercussion that the communication of bad news can trigger in the medical sick tandem. 1. Fear of causing pain. 2. Fear of therapeutic failure. And 3. Legal fear. There are 4 points to give a practical, agile, and dynamic procedure to inform the patient. The first one, give him all the available information about his health status and his illness. This will allow the doctor to determine what the patient knows and their expectations regarding the adverse diagnosis. 2. Provide information in accordance with the needs and wishes of the patient. 3. Provide communication skills that reduce the emotional impact that bad news has one to receive. And 4. Agree on a treatment plan that allows a high degree of patient cooperation. Now, from an ethical point of view, given the bad news, we can use the personalism that it is a philosophical current that puts emphasis on the person. It considers man as a relational being, essential, social, and it lives in a community, a free being, transcendent, and with a value in self that prevents him from becoming a subject as such. Now, we know this as a doctors, we have to take this very important point because we must learn to tell news with no cruel because this is very important for the patient, emotional for itself and for the family.